Hello everybody, my name is Heather Brown. I'm a registered nurse and instructor with Gurnick Academy of Medical Arts. This presentation will be for our fundamentals course on Chapter 16, Infection Prevention and Control. So protection, mechanisms, as well as asepsis. This chapter, Chapter 16, there's no specific quiz on this content. The content in this chapter will be tested within your guys' midterm exam. So refer to your syllabus for more information on that. The date for your midterm will be 5/5, so May 5th. So let's go ahead and get started here with Chapter 16. Here's our introduction slide for Lesson 16.1, Infection Overview. So this covers what we're going to be learning in theory. So the first thing that we're going to be covering is to be able to list the type of microorganisms that can cause infection in humans. Number 2, we're going to be able to discuss the links in the infection process and give an example of each. Number 3, we're going to discuss the factors that make older adults more susceptible to infection. Number 4, we're going to be able to explain how body's protective mechanisms work to prevent infection. And lastly, we're going to be able to explain how the inflammatory and immune responses protect the body. Infection. Infection is entry into the body of an infectious agent, a microorganism, that then multiplies and causes tissue damage. A pathogen is a microorganism capable of causing disease. So a pathogen is a disease-causing microorganism. Some microorganisms produce toxins, and others release endotoxins. Infection may result in illness and disease. So this infection topic is discussed a lot in your A&P course. We're going to cover it here as well. So understanding it here or understanding it there, it's only going to help you for both courses. Here's our list of infectious agents that we're going to be covering in detail in the upcoming slides. So we have bacteria, prions, viruses, protozoa, rickettsias, fungi, helminths, as well as a couple others. Bacteria. Bacteria are single-celled microorganisms that lack a nucleus. So even though they don't have a nucleus, bacteria are able to reproduce very quickly. So they reproduce every few minutes up to several weeks. And they're classified according to their need for oxygen, as well as by their shape and how they're gram-stained. So in the previous slide, we said bacteria were categorized by a couple of different ways. So the first is by the need for oxygen. We have aerobic and anaerobic bacteria. Aerobic bacteria need oxygen to grow and thrive, whereas anaerobic bacteria, they can grow only without oxygen. The next type of classification here is on gram staining. So we have gram-positive bacteria and gram-negative bacteria. Gram-positive bacteria retain the stain if stained, and gram-negative bacteria take up the counter stain. And the last classification we see here is based on shape. So cocci are round, bacilli are rod-shaped, and spirochetes are spiral or corkscrew-shaped. So these are a couple of the main different type of classifications of bacteria: oxygen, gram staining, as well as shape. Bacteria. So they can be identified by chemical testing and growing cultures. So cultures. This is important for you guys to know as nurses. So a culture is where a body secretion, for example, from a wound, or maybe even from the throat. This is transferred to a medium where it can grow. So they basically grow out a culture. A sensitivity test is then performed to see what antibiotic is effective against that bacteria. So they grow it from a culture, and then they do a sensitivity test to see what antibiotic can work against that bacteria. Sensitivity results can be available in 48 to 72 hours, and then the doctor can prescribe an antibiotic that works specifically on what is growing. Now, what a doctor will normally do is start a patient on a broad spectrum antibiotic. A broad spectrum, it has effectiveness on many things. So it's a broad spectrum. But then whenever he gets back the sensitivity results and he sees what was growing and what can kill this bacteria, that's when the doctor will change from a broad spectrum if to something more specific based on what's grown in that culture. So you might have seen before where you go to the doctor for an appointment, they take a culture and they say, hey, I'm going to start you on this and we'll call you if you need to be on something else. So that's where they've done a culture and sensitivity test. So sensitivity testing determines which antibiotic can kill the organism, and some are drug resistant. So here's our list of multi-drug resistant organisms. So we have MRSA, VRE, ESBL. We also have C. diff and penicillin-resistant strep pneumoniae. So these are our multi-drug resistant organisms. So when it comes to educating our patients, we always want to make sure that we tell our patients if they're prescribed an antibiotic that they need to take the whole course, even if they're feeling better. So if they're feeling better on day 2 or 3, but it's a 5-day course, they need to make sure that they take all of the medication. Because if they stopped, it prevents the whole microorganism from being killed off. And then it can actually come back, and then they won't have enough antibiotics to fight. So as an educator for your patients, always make sure that we're instructing them to take the entire course of their antibiotic. Viruses. So viruses are parasites. They're parasites. They cannot obtain food, they can't rid their waste, and they can't reproduce without a host cell. They're extremely small. They can only be seen with an electron microscope. We'll actually see a view of them in the next slide. They're composed of particles of nucleic acids, either DNA or RNA, with a protein coat. So that protein coat can dry and protect a virus for years, even decades. They grow and replicate only with a living cell. Like I said, they require a host. Survival and replication depend on that host that they're living off of. Here's the electron microscope. This is the view of the virus. Protozoa. Protozoa are also parasites. They're one-celled microscopic organisms belonging to the animal kingdom. So we have some examples here. I don't need you to memorize the different examples, just that protozoa are also parasites. They're one-celled microscopic organisms. Rickettsia. Rickettsia is also a parasite. So these use fleas, ticks, lice to vector to humans. So they use a host cell for energy or ATP, as well as for vitamins, minerals, and nutrients. But these ones are able to reproduce independently. So they're small, round, or rod-shaped organisms. They're transmitted by the bites of fleas, lice, mites, and ticks. And they can multiply only in host cells. And they cause Rocky Mountain spotted fever and typhus. Fungi. Fungi are tiny, primitive organisms of the plant kingdom that contain no chlorophyll. They include yeast and mold. They feed off of living animals and decaying organic matter. They reproduce by use of spores, and they cause candidiasis and tinea pedis, or what we know as athlete's foot. It can also cause thrush, vaginitis, pneumonia, and meningitis. Helminths, parasitic worms or flukes. So they belong to the animal kingdom. Pinworms are the most common helminths worldwide. These most commonly affect children. And roundworms and tapeworms are other types of helminths or worms. So helminths, these are transmitted by ingesting a fertilized egg or by larvae penetrating through the skin or mucous membranes. Now we're going to be looking at the process or the chain of infection. So an infectious disease is spread from one person to another. It's a continuous chain. So we're going to be looking at a picture in the next slide that will help this make sense. So the chain links include the causative agent. This is our first link. The reservoir, the portal of exit, the mode of transfer, the portal of entry, as well as the susceptible host. So we're going to be going into these in the next couple slides, guys. So this is figure 16-3 from our textbook in fundamentals. The causative agent, remember, this is our first link. It's at the top. And then we're seeing those other links that we mentioned on the introduction slide: the reservoir, the portal of exit, the mode of transfer, the portal of entry, and the susceptible host. Notice that they're all linked together. So now we're going to be going into each one of these. Causative agent, this is our link number 1. Any microorganism or biologic agent is capable of causing disease. So pathogenic microorganisms must be destroyed or rendered harmless in order to remove this link from the chain. So we already talked about some of those things in our second bullet point. We've already covered those. Virulence of the agent is affected by its ability to. So virulence, that's its ability to cause harm. So how dangerous, how harmful it is. So how harmful it is depends on several factors. So some of those factors is if it can adhere to mucosal surface or skin, if it can penetrate mucous membranes, if it can multiply once in the body, if it can secrete harmful enzymes or toxins, and if it can resist the process of phagocytosis. So depending on these factors, it will tell how deadly that causative agent is. Now we're on reservoir. This is another link in our infection chain. So the reservoir, this is where places where the microorganisms are found. So examples include infected wounds, human-animal waste, animals and insects, contaminated food and water, and the person with an infection. Some places that serve as reservoirs include the GI tract, the lungs, the liver, and the kidneys. So if a patient had pneumococcal pneumonia, the lungs would be the patient's reservoir. So precautions to prevent the spread of infection include good hand hygiene. We've stressed that throughout most of our lectures, is that the great precaution that you guys can do is good hand hygiene as well as sterile technique. So that's covered in one of our chapters this evening as well. Portal of exit. So this is another link in our chain of infection. So this is the route by which the pathogen leaves its host. So this is the exit route. The portal of exit transmission can be interrupted by identifying and treating patients who are infected with pathogens. So remember that a pathogen is a disease-causing microorganism. Here we see some examples of the portal of exit. So we see the GI tract, the respiratory tract, as well as the skin and mucous membranes. So the GI tract, feces may transport the typhoid bacillus from an infected person. The respiratory tract is another portal of exit. So microorganisms are released by coughing or sneezing. Measles, mumps, pulmonary TB can be transmitted by exit from the respiratory tract. So that's like saying TB, if you were coughing and sneezing and those droplets ended up getting into another person, this is how it could be transmitted. Whenever it exits one person, it could be transmitted to another. And then the skin and mucous membranes, open wounds. So open wounds and its drainage, this is another portal of exit. Modes of transfer. So this is another link in our chain of infection. So modes of transfer, we have direct personal contact, indirect contact, vectors, as well as droplet infection. So direct personal contact with body, excreta, or drainage from an ulcer, infected wound, a boil. These are all examples of direct personal contact. This is how a transfer would be made. Indirect contact includes contaminated inanimate objects, such as needles, eating utensils, or dressings. Vectors, such as mosquitoes, they harbor infectious agents and transmit them through bites and stings. Droplet, so we've talked about the masks needed for droplet infection. So droplet or contamination by the aerosol route through sneezing and coughing. Spread of infection from one body part to another. So this is when we have a transfer. So the mode of transmission can be interrupted by effective hand hygiene, also by proper disinfection and sterilization of medical equipment. So once again, more emphasis on the importance of hand hygiene. Things that we can teach our patients is to make sure to cover their mouth when sneezing or coughing, how to dispose of soiled tissues correctly, and washing their hands. So that would be some patient teaching points. Portal of entry. This is where a microorganism enters the body through, say, our eyes, our mouth, perhaps our nose, our trachea, our skin, or our mucous membranes. These are all portals of entry. So to prevent entry of a microorganism, we want to use only sterile and clean items in patient care, something we've learned about. We want to use barrier precautions. We want to safely handle food and water, use good personal hygiene, avoid high-risk behaviors, and use protection from insect bites and stings. So these are just basic things we can do to prevent entry of a microorganism. Susceptible host. Susceptible hosts can be protected by using aseptic techniques, barrier precautions, which we mentioned a few in the previous slide, and protective isolation, which we've talked about protective isolation in this presentation. So some ways that we can decrease susceptibility is by keeping our immune system healthy, improving our living conditions, making sure that we're using proper hygiene techniques, and utilizing insect spray for those mosquitoes that we mentioned. And some factors that increase our susceptibility are the age of an individual and their state of health, and whether or not they have a broken skin. So on this slide, we see a human host may be susceptible by virtue of age, state of health, and broken skin. And susceptibility can be decreased by teaching good health and hygiene habits. And immunizations is another thing that we can do to decrease our susceptibility of getting something. Susceptibility of the older adult. So there's lots of additional information that I'm going to give on this slide. I've also at the bottom of this slide included to refer to table 16.5 on increased susceptibility of the older adult to infection. So I do encourage you to look here. Some of these nursing interventions look very basic. Remember, a lot of times as a nurse, we're not doing the cool things we see on the TV. We're usually doing basic interventions. Things that promote good oral hygiene, or instructing proper food storage, or just simply encouraging fluid intake. Some of these basic things that we forget are nursing things as well. So refer to that table I have listed here on this slide. So factors that place the older adult at risk for infection include, these aren't all of them, but these are some of the factors: poor nutrition, immobility, poor hygiene, chronic illness, and physiological changes such as thinner skin. So if we wanted to prevent a UTI in an older patient, we'd want to make sure that they're keeping their urine very dilute, okay? We want the urine diluted rather than very concentrated. So that's just a basic thing we can do, is encourage fluid intake to help keep their urine very diluted. Because remember, concentrated could put them at risk. Other things that we can do for our patients that are immobile, we want to help prevent them from getting pneumonia from being in bed if they're immobile. Basic things we can teach them is turn, cough, and deep breathe. You'll read that so much within this fundamentals book. You'll learn it throughout this Gurnick program. But turn, cough, and deep breathing, very basic, but a very important thing to teach our patients. So for our mobile patients, those recovering from surgery, we want to prevent pneumonia by teaching them to turn, cough, and deep breathe. So once again, refer to this table here for additional resources there. And I've given you guys also a couple of examples to consider of those more basic nursing interventions that we need to focus on. Body defenses against infection. Intact skin is the first line of defense against infection. So we've talked about a greater risk factor is if our skin is not intact. So intact skin is our first line of defense against infection. Secretions or lysosomes from mucous membranes lining the respiratory, GI, and the reproductive tracts. This is another defense agent. There's also cilia in the respiratory tract. So cilia lines the respiratory tract. It can help trap microorganisms and debris and propel them up and out of the body with a wave-like action, so it's also protective. The Kupffer cells in the liver. So these destroy bacteria that have found their way into the portal circulation. And lastly, gastric secretions. These are useful. An example is hydrochloric acid because they destroy ingested pathogens. Remember, a pathogen is a disease-causing microorganism. So in this slide, we're seeing several different defenses we have to fight against infection. So we saw that intact skin was our first line of defense. Now we're going to be going into our second line of defense. So the first one we're going to cover is fever. So fever slows the growth of many pathogens until other defenses can be mobilized. So it helps slows it down until our body and our other defenses can begin working. Leukocytosis. So leukocytes engulf the invader. And then we have phagocytosis. Phagocytes remove cellular debris, destroying bacteria and viruses. They also remove metabolic waste products. The next second line of defense that we have is inflammation. And then we have interferons. So this stimulates antiviral proteins. So what's the difference between, how do we tell the difference between a viral and a bacterial infection? So if we're trying to tell the difference lab-wise, there's a large increase in the percentage of monocytes. This is usually how we can distinguish if something's a viral infection versus a bacterial. So that monocyte number increases, and this indicates a bacterial infection compared to a viral infection. So that's one example that we can see bacterial versus viral. Inflammatory response. So we have localized protective response brought on by injury or destruction of tissue. So that's where our body sends troops to a specific site. And what happens is we see inflammation there. So all of our troops are going to that site. And as our fighters end up there, we see inflammation at that location. It's localized inflammation. Our blood vessels also dilate, getting larger, which brings more blood to that area. So think of the roadways open up. So it brings more blood to that area, causing redness, warmth, and edema. So say you cut your finger, your blood vessels in that area would dilate, sending more blood down to your hand, and you'd feel that area warm. You might see some edema and some redness. So the purpose of this inflammatory response is to neutralize and destroy harmful agents. We also want to limit their spread to other tissues. So we send all of our fighters there to help prevent it from expanding. And we want to prepare the damaged tissue for repair. So that's the purpose of this inflammatory response. Immune response. So make sure you pay special attention to this information. It's a lot of information on just one slide. So we have acquired or active immunity. This is the body's deliberate production of antibodies or lymphocytes to target a specific antigen. So that's acquired or active immunity. Passive immunity, on the other hand, this is temporary protection with antibodies that will decrease over time. So that's the main difference, acquired or active versus passive. So let's look at some of these. So we have passive acquired immunity. So this is where we give an antitoxin containing antibodies or antitoxins. Naturally acquired passive immunity is where it's naturally acquired. So this is an example where the fetus receives antibodies from the mother. So this is naturally acquired passive immunity. Next, we have artificially acquired immunity. So this is our immunizations. Immunizations which promote the body to produce antibodies specific to the immunization that was given. So polio, for example. So that's going to promote the body to produce antibodies against that specific thing. This is an example of artificially acquired immunity. And then last, we have passive artificially acquired immunity. So this is where we inject antibodies derived from a serum of infected people or animals. This is passive artificially acquired immunity. So we have 4 different responses here. So once again, if you're getting an immunization, the reason that you would explain is that we want to stimulate the body to make antibodies to that specific thing. So if it's the Hep B immunization, we want to stimulate the body to make antibodies to that Hep B antigen. If it's polio, we want to stimulate the body to make antibodies to the polio antigen. So it's important that you're able to know how to explain why we're giving an immunization and what it does. Review question number 1. So which person is at highest risk for developing a hospital-acquired infection, an HIA, or a nosocomial infection? Go ahead and read, and then we'll cover the answer. All right, guys, so the answer here is number 3. So an 80-year-old cancer patient. Elderly patients are at high risk of infection because of things like poor nutrition, immobility, chronic illness, and physiologic changes. So in this question, our answer is 3. Lesson 16.2, Protective Mechanisms and Asepsis. So here are 3 points that we're going to be learning. So point number 6, we're going to learn how to identify means for removal or destruction of microorganisms on inanimate or inanimate objects. Number 7, we're going to compare and contrast medical asepsis and surgical asepsis. And number 8, we're going to describe accepted methods of disinfection and sterilization. This introduction slide covers what we're going to be learning as far as clinical practice. So point number 1, we're going to discuss surveillance, prevention, and control of infections in hospitalized patients. Point number 2, we're going to demonstrate proper hand hygiene techniques. Number 3, we're going to consistently demonstrate the application of the U.S. Centers for Disease Controls and Prevention, the CDC standard, and transmission-based precautions while caring for patients. And number 4, we're going to prepare to teach home care patient with wound infection how to prevent the spread of infection to family members. Asepsis and control of microorganisms. So not all organisms are destroyed by asepsis. So asepsis is where we make the environment and objects free or as much as we can of microorganisms. Medical asepsis, this is where we reduce the number of organisms or reducing the risk of transmission of organisms. So this prevents the spread of infection from person to person or reinfection of the same person. And it involves cleanliness and protecting items from contamination and disinfecting contaminated items. So continuing that topic, but now looking at surgical asepsis. So surgical asepsis is referred to as sterile technique. So a common example of something that needs to be done utilizing sterile technique is insertion of a urinary catheter. So surgical asepsis is preparing and handling instruments and materials in a way that prevents the patient's exposure to living microorganisms. So I've given the example of insertion of a urinary catheter. So it involves sterilization of all surgical instruments used in surgery and of supplies used to invade the body, such as catheters or needles. So when a nurse is performing a procedure using sterile technique in the patient's room, it means that all organisms have been killed or removed from the materials that come in contact with the patient. So I'll repeat that. When the nurse is performing a procedure using sterile technique in the patient's room, it means that all organisms have been killed or removed from materials that come in contact with that patient. Hand hygiene. This is one of the most effective ways to reduce the number of microorganisms on the hands. Gloves should be used to prevent contact with any body fluids. So we've talked about gloves needed when we're handling body fluids. Remember, gloves don't mean you don't need to wash your hands. Healthcare workers must perform hand hygiene before and after giving care to the patient. That even includes when gloves are worn. And us as healthcare professionals, we should avoid wearing jewelry because microorganisms can become stuck on jewelry. So they get stuck under things like our diamonds, and then we end up carrying them around and carrying them home with us. We also want to be mindful to keep our fingernails clean and short. Once again, microorganisms can hide here. So these are some of the things that we can do. These are also some of the things that we can teach family members about hand hygiene in the home, is that they too should consider keeping their fingernails short and avoiding wearing rings if they're taking care of a loved one that especially has an infection. Standard precautions. Standard precautions are to be used with every patient as they protect the patient and the nurse. So you can refer to box 16.3 for this information. So standard precautions as outlined by the CDC are to be used when caring for all patients. So this includes things like hand hygienes, glove, mask or eye protection, gowns, patient care equipment, environmental control, linens, occupational health and bloodborne pathogens, and also where we place our patients. Gowns. Gowns are to be worn when there's a chance of being splashed by blood or body fluid or other potentially infectious materials. So they provide a clean barrier that is impermeable to fluid. It must be impermeable to water, and it is removed after use, being careful not to contaminate the skin or clothing. Masks. So these are applied before entering a room if chance of contact with an airborne pathogen or splashed body fluids exists. They're placed over the nose and mouth and secured by an elastic band or ties. N95 respirator masks are worn when entering an area where pulmonary tuberculosis or other dangerous airborne microorganisms are present. So N95 respirator masks, these must be approved by OSHA, and they prevent passage of 95% of particulate matter. So there's several types um, of masks, and we'll look at a couple in the next slide, but there's lots of different masks that exist, but those N95, those are the ones we need to use for our airborne precaution patients. They're also called particulate masks or N95s, and I have known them as duckbill masks. So let's look at those in this next slide. So here are some masks. We see 3 masks in this picture. So picture A, we have a performed mask. Picture B, we have the accordion mask with ties. And in picture C, we have one type of N95 mask. This is what I said I've known as duckbill mask. So you can kind of see how that name came about. It does look a little bit like a duckbill. So this is one type of N95 mask in picture C. Protective eyewear. So protective eyewear is used to prevent fluid from entering the eye area and coming in contact with the mucosa or surface of the eye through splattering. So we should wear eyewear for performing oral, nasotracheal, or endotracheal or ET suctioning. So these are definitely procedures that we'd want to have eyewear on. Other things that we'd want to utilize eyewear for is for performing wound irrigations or assisting with a procedure in which blood may splatter, like insertion of a central line. So I once watched a doctor remove a central line, and he pulled out the central line as fast as he could, and as he pulled it out very quickly, blood splattered, I would say 6 or 8 feet from him all over the room, and definitely you want to make sure, especially with something like a central line, that you have your eyeglasses on, because that is a procedure that can be quite messy. So, so eyewear may be goggles, a face shield, or glasses with side and top pieces. It just depends on what your facility carries and also what you prefer to use. Head covers. So these are worn if danger of contamination of the hair or if microorganisms um, resident in the hair might endanger the patient. So we want to remove it carefully. So the way we remove it is by slipping the fingers beneath the elastic and handling only the inner surface of the contaminated head cover. So think about the exterior of the head covering, that it's all been exposed. So when we remove it, we want to make sure we slip our fingers underneath that elastic without touching the top. So we're just touching the inner surface. Shoe covers. Shoes are covered so that pathogens are not carried out of the room. So covers are removed when exiting the room. So I've seen surgeons do this many times where they wear shoe covers around everywhere. So it's just like an extra shoe that they're wearing. So for these to be utilized correctly, that the covers need to be removed when exiting the room. Otherwise, you're taking all those microorganisms or pathogens to the next room that you go in. So they're one-time use while you're in the room, and when you exit the room, they need to be removed. Gloves. So this is used for standard precautions. They're worn when there is a chance that there will be contact with blood or body fluids, mucous membranes, or non-intact skin or secretions. And they reduce the possibility of transmission of microorganisms from the nurse to the patient. So remember, gloves can never be reused or washed. Hand hygiene is performed before gloving and immediately after removing the gloves, because no glove is 100% protective. So gloves, although very useful, they don't take away our need to wash our hands. Latex allergy. So this may cause redness, local inflammation, and pruritus, which is itching of the hands, as well as potentially anaphylaxis. How we can prevent this is by using gloves appropriately and not for routine tasks. So when we need gloves, use them. If we don't need them, don't use them. They should be removed directly over a trash receptacle without snapping them off. And we do not want to use petroleum-based lotions under latex gloves. Now, if a healthcare worker has a latex allergy, by law, the employer must apply an alternative type of glove. Disposal of sharps. So they should be placed directly in a special red puncture-resistant sharps biohazard container immediately after use. So remember that we want to make sure that we remove and replace that sharps container when they're 2/3 full. We don't want those sharps containers to become more full than that. The containers actually have a line on it that shows where they should replace that container. We never want to recap used needles. We can use a one-handed scoop technique if needed, but we never, ever recap used needles. All needles, IV cannulas, and items that might cause a skin break are placed in a sharps container. So once again, we never recap the needle after we've used it on a patient to avoid the risk of needle stick. Contaminated waste. So contaminated waste must be disposed of in a sealed, impermeable plastic bag marked hazardous waste or biohazard. These are typically red bags, and most people in healthcare will say red bags, but that's a biohazard or a hazardous waste bag. So what we put in this includes soil dressings, used sanitary pads, suction drainage containers, and any other item that has been in contact with body fluids. So when we handle these contaminated items, we want to make sure that we're always disposing of them in the correct manner. Cleaning. Pathogens can be killed or inactivated by disinfection, sterilization, or sanitizing agents. Clean or remove debris in cold water. Wash and scrub in hot water. Use a stiff bristled brush. And rinse with hot water and make sure that we always dry. Sterilization. This is the best method for eliminating microorganisms. So there's 5 different methods of sterilization. This includes steam or moist heat, dry heat or hot air, ethylene oxide, low temperature gas plasma, or radiation. So these are 5 methods of sterilization. I'm not going to go into these in great detail. That's too specific for your guys' needs. Sepsis in the home environment. So now we're switching over to the home environment. So a 1 to 10 solution of chlorine bleach in water can be used on counters and bathrooms. We want to run the dishwasher on the sanitize cycle. Frequent damp dusting and vacuuming reduces microorganisms. Forceps Scissors and other instruments can be washed with hot water and detergent, then soaked in bleach solution. So these might be some different things in the home environment that we can teach our patients and families. Infection control surveillance. So there's an infection control practitioner. So hospitals, acute care, long-term care facilities, they usually have a specialist that works specifically on the topic of infection control. So this individual would be responsible for ensuring infection prevention and control measures are followed. So they survey what the staff is doing and make sure that the rules are being followed. They work with the healthcare staff to ensure they understand which patient care and environmental cleaning measures are to be used. So oftentimes things will change in healthcare, and this person would make sure that all staff understand and that the correct measures are being utilized. And they assess for the spread of infection. So I worked at a facility once where the surgical rates of infection were increasing. And I remember talking to our infection control nurse, and she actually went into the operating rooms to see, were they utilizing new equipment? Did they have new staff? Were surgeries higher at that time? Maybe staff was rushing. So it was pretty interesting. She was talking to me about how she was assessing that spread of infection, why the rates were suddenly higher. So for some of you, you might find that to be a very cool, interesting area of nursing. So there are infection control practitioners, and that's their main focus in their position. Review question number 2. The most effective way to destroy all types of microorganisms is to. So I'm going to pause, allow you to read, and then we'll review the answer. All right, guys, so the answer here is number 1. So there's a lot of material in this presentation. There's a lot of material in your guys' book, but the answer here is number 1. So the most effective means for destroying viruses and all other microorganisms is to expose them to moist heat at temperature of 250 degrees Fahrenheit for 16 to 20 minutes. So this is accomplished by using an autoclave. So this is a piece of equipment that make sure that that temperature is maintained for that duration of time. So this is accomplished by use of an autoclave. The answer here is 1. Review question number 3. An LPN is going in for her annual review. She is told to stop by employee health to get a hepatitis B shot. This is providing the employee which type of immunity. So we have a specific slide on this. I'd refer back to it, and then we'll cover the answer in a second. All right, guys, so the answer here is number 4. So this is artificially acquired immunity. So this is achieved through an injection of vaccines that contain dead organisms such as polio, measles, influenza, and hepatitis B vaccine. So the answer here is 4. Review question number 4. Brenda is a student nurse observing and assisting in the operating room. In order to maintain surgical asepsis, she must include all of the following except. So all of the following except. Remember, we call surgical asepsis sterile technique. All right, guys, so numbers 1, 2, and 3, these are appropriate. Number 4 is our correct answer. So maintaining clean technique while in operating room. So maintaining clean technique while in operating room is medical asepsis and not surgical asepsis. So it is essential in the operating room that all microorganisms are destroyed. So we want to utilize surgical asepsis. So the answer here is 4. Numbers 1, 2, and 3, these are all appropriate, but number 4 is our answer. Review question number 5. Sherry is working as a home health nurse. She is teaching her patient and family about asepsis in the home environment. All the following are true except. So everything is true except for 1. Go ahead and read, and then I'll cover. All right, guys, so the answer here is 2. Hand washing is the most effective way to prevent the transfer of microorganisms. It should be done before and after caring for the patient, whether in the hospital or home, and following the same technique. So the answer here is number 2. So this concludes our lecture. I hope you all enjoyed, and I hope you're all doing well. Thanks so much, guys.